Thank you all for joining today's update on COVID-19 in North Carolina. As of today, we have 5,123 confirmed cases in our state, 431 people in the hospital, and 117 deaths. As with every day, our prayers are with those fighting this virus and the families and friends of those who've lost their lives. Orders to stay at home and limit occupancy in stores are in effect, as well as bans on large gatherings and closures of certain types of businesses that can't practice social distancing. And I'm sure I don't need to remind parents out there that schools are closed. But because of these measures and the good work of North Carolinians, our hospitals are not overwhelmed right now. Hospital beds, ICU beds, and ventilators are available. North Carolina has the capacity to treat patients who contract the virus. Our efforts to flatten the curve are working, and that means we have saved lives. The stay-at-home orders are working, but we know our current situation is not sustainable in the long run. We can't stay home forever. And I know people are wondering, where do we go from here? On Monday, I talked about significant efforts underway to consider when and how we'll be able to ease restrictions. Today, I want to share more about what's going into those considerations. This virus is going to be with us until there's a vaccine, which may be a year or more away. That means as we ease restrictions, we're going to enter a new normal. We want to get back to work, while at the same time preventing that spike that will overwhelm our hospitals with COVID-19 patients. Today, I want to tell North Carolinians that in order to ease restrictions, we need to make progress in 3 areas: testing, tracing, and trends. First, testing. Our new normal relies on an increase in testing capabilities to isolate and track new cases of COVID-19. This means having the supplies and lab capacity to do more diagnostic testing, as well as reliable antibody testing that can tell us who has had the virus. Dr. Cohen is bringing together partners from the public and private sector to coordinate efforts to ensure that testing is widely available across the state. And I'll let her talk more about that in a minute. Second, tracing. We have to boost our public health workforce to trace and track new cases of COVID-19. Contact tracing can be effective in containing new outbreaks, but it requires a lot of people and a lot of legwork. When a new positive case pops up, the tracing efforts will work to identify people who've been in contact so that they can get tested and take the right precautions. Our North Carolina Department of Health and Human Services will enter partnerships with universities and hospitals and others that will increase our public health workforce and get this job done. And finally, trends. In order to ease restrictions, we have to see COVID-19 trends move in the right direction. That includes trends in the number of new positive cases, the numbers of people in the hospital, the numbers of deaths, as well as how that works with the available supply of personal protective equipment, hospital capacity, and more. We know we must continue to protect our state, especially the most vulnerable and high-risk people, even after we've eased certain restrictions. Until we have a vaccine or effective and available treatment, these people are still uniquely at risk. In our new normal, we will still have to decrease the risk of exposure for older people and those with underlying health conditions, and continue strong precautions in nursing homes and other congregate living settings. In our new normal, you may see more people wearing masks or having their temperature checked. A restaurant you may go into may have tables that are only partially full. The only sporting events or concerts that you may be able to watch for a while will have no in-person crowds. A new normal can get us back to work, back to school, and back to play, but in a new way for a while. Experts tell us it would be dangerous to lift our restrictions all at once. Rather than an on-off light switch, think about it more as a dimmer switch, which can be adjusted incrementally. As we slowly bring the lights back up, we have to monitor for troubling signs of a spike in cases that could overwhelm our hospitals and risk lives. So getting this right, testing, tracing, and trends, is the most important step. It will lead to getting our state's economic recovery right, too. Sending people back to work and school while making sure recovery money is flowing to people and small businesses is absolutely essential. So are the right public health measures to give each other confidence that we can go back to our lives safely and that health care will be there when we need it. Now, I know the changes that we've all made in our lives seem to have happened very quickly. And it's important to understand that undoing those changes won't happen as fast. To protect our health and long-term economic prosperity, we have to act with care rather than haste. Like everybody else, I'm anxious to get North Carolina back to normal. But we have to be realistic for a while. There will be a new normal. As we adjust, I know that North Carolinians will continue to look out for one another as we work together to recover our economy and beat this virus. And we will beat this virus. With me today, I have our Secretary of Health and Human Services, Dr. Mandy Cohen, our Secretary of Public Safety, Eric Hooks, and our Director of Emergency Management, Mike Sprayberry. Karen Magoon and Nicole Fox are providing American Sign Language. And as always, behind the scenes, Jackie and Jasmine Mativier are our Spanish language interpreters. Dr. Cohen, I'll recognize you.
Thank you, Governor. Thanks to your leadership, we've been taking aggressive action, and the good news is it's working. We're flattening the curve, and fewer people are getting sick at the same time. Because we acted early, and because we acted together, we have averted the devastating scenarios we've seen playing out in other parts of the country and across the globe. As the governor said, we now need to look ahead at how we keep doing that. How do we stay ahead of the curve? Knowing that this virus is going to be with us for some time, that it's a highly contagious virus, and that for some, this virus is very dangerous. As with all our decisions, our next steps will be driven by science and data. Our plan is to stay ahead of the curve, and it has 3 prongs: testing, tracing, and trends. This will allow us to identify who has COVID-19, quickly act to stop the spread, and know when we need to dial up or dial down our social distancing policies. So when it comes to testing, we're in a much better place than we were even just a month ago. There are more labs that are doing COVID-19 testing, wait times for results have been drastically reduced, and the shortage of testing supplies has eased. But we're not out of the woods yet. Personal protective equipment, the gowns, the masks, the gloves, continue to be a limiting factor. Those shortages of protective equipment, those gowns and masks, means that we must be judicious in how we use these resources. And that also means it has to be available for our healthcare workers who care for those with COVID-19. Fortunately, we're seeing the private sector do what it does best: innovate. There are new testing methods in development that could be self-administered, reducing the need for protective equipment for testing going forward. I'm looking forward to those developments. In addition, I'm standing up a testing surge work group with leaders from the public and private sector to tackle these issues. This group is charged with developing a plan to increase testing capacity, expand testing sites and options, and address those supply challenges. Tracing is something we know how to do well here in North Carolina. Tracing is when you do that detective work to find all the people and places someone may have been when they were infectious with a disease. Our local health departments already have 250 or so trained professionals with experience doing this detective work. When a person tests positive for COVID-19, tracing efforts help identify who that individual may have been in contact with, so that people get tested and take the right precautions not to infect others. Going forward, it will take a much larger team to aggressively trace the contacts of everyone who tests positive for COVID-19. And as the governor mentioned, we're working with partners to ramp up staffing and explore digital tracing technology options. All of this, our testing and tracing, along with additional data, will inform our trends. We need to understand how COVID-19 is impacting our state and impacting specific populations and regions of our state so we can calibrate our response. Last week, we launched our enhanced COVID-19 surveillance tool. We know that laboratory testing is only a part of what we need to do. It only provides a limited snapshot of the number of people with the virus. Our surveillance tools tell us more. We also have a team of data scientists from the private sector who will continue to fine-tune modelings that are based on North Carolina's own demographics and our own experience with the virus. In addition, we're going to need to better understand how many people with COVID-19 that don't have any symptoms and what that looks like, and how many people have already been exposed to the virus. We're going to continue to work with our academic and research partners to paint a more complete picture of this virus in North Carolina. So to recap, widespread testing, aggressive contact tracing, and data-informed policy decisions are our best tools to keep our communities safe and protect our frontline workers. Together, we will stay ahead of the curve. Thank you, Governor.
Thank you, Dr. Cohen, and appreciate your strong leadership in this arena.